Hello everybody, I'm Ruth Hannon. I'm the Transform Programme Manager at the RSA, and it's my great pleasure to welcome today's guest, Andy Burnham. Andy is the Mayor of Greater Manchester, leading Greater Manchester's combined authority for the last 3 years. He's also a former Cabinet Minister, serving as Health Secretary, Culture Secretary and Chief Secretary to the Treasury. I think you might have had more jobs than me, Andy, which is saying something.
Never done a real job.
Andy's knowledge about UK politics is extensive, and since moving to Greater Manchester to become the Combined Authority Mayor, has brought that wealth of knowledge with him to his role. And we're lucky to have him here today to talk a little bit about health, social care, devolution. We may even mention football. We are in Manchester after all. Andy, thank you for joining us.
You're welcome,
it's a really great opportunity to have you here. First of all, I would be remiss without asking, how are you doing?
Oh, not bad. It's been a long haul, hasn't it? Lockdown. I think everybody's feeling that, myself included. But yeah, not too bad, thanks. The family have seen more of me in the last 2 months than they have in the last 20 years, and I'm not sure whether that's a good or a bad thing, but you have to talk to them about that.
Yes, I think a lot of us are feeling that way. So I think the first thing, it would be a really great opportunity to find out, seeing that we are both in Manchester, about how you felt about Marcus Rashford's achievement last week. I know that the entire Manchester area of both red and blue had strong feelings about it, and I just thought it would be a good opportunity to ask your feeling, and this will be the last time I'll mention football.
Well, I'm glad you have, because it was wonderful, wasn't it, to see the way he kind of came over in that public domain, you know, with his personal experience, but talking with passion. It was just undeniable, wasn't it? And I just think it was a fantastic example of a footballer using their profile. So I felt immensely proud of him, actually, is the honest answer. I met Marcus with his mum and his family earlier this year. Seems an age ago now, but you know, we sat in my office in Manchester, and he was talking about things he wanted to do to support people. And I could tell then that he kind of had the bit between his teeth. And if you're honest, you don't necessarily expect it from a 22-year-old footballer, you know, with other priorities. But yeah, absolutely wonderful. And I think a mural has gone up to him in the last couple of days, which I think tells you what the people feel about what he's done. So just to see someone like him speaking for kids who are often forgotten by politicians just was fantastic.
Yeah, that's great. Thank you. And I think that sort of following on from that, I was interested to see the quite swift response from Greater Manchester on the Black Lives Matter movement. And you've outlined a plan for a race equality panel. And I was thinking about that in relation to what has come out of the pandemic with the contribution of health inequalities to people's chances of surviving, and I'm just wondering what you hope will come out of that panel.
No, I think this is a moment, isn't it, to look at the inequalities in our country through new eyes and to resolve to take much more meaningful action. You know, I look back actually to February when Professor Sir Michael Marmot published his 10-year on review from the report on health inequalities, which he presented to me as Health Secretary. And he was quite clear then that we'd gone backwards in so many ways, and it was Black, Asian and other communities that were most affected by the cuts that we've seen over the last 10 years. And that was before the virus. So then you kind of take that worsening picture on health inequalities and add a pandemic into it, and it's awful, isn't it? You know, it's clear that it's disproportionately impacted on the poorest communities, which often happen to be where more people from minority communities live. So the Bangladeshi community in particular hit very hard by COVID-19. So, you know, why have we in this country had such a high death rate? I think it is linked to the level of inequality that we have got, and the lack of resilience that some people and communities have as a result of that. And I hope that there'll be a a kind of national resolution to do something about that. But I'm not sure there will be, but it's my hope anyway.
Mm. Yeah, you said about a national resolution. I'm just wondering about what you feel can be achieved at the GM level, with it being, that sort of uniqueness of a devolved government.
Yeah, there are some things we can do. It's not always about just pointing the finger at government. We need to start with ourselves. So, a couple of things I would say in answer to that. I think the nature of people's work and their housing is fundamental to whether or not they can have health. If we look at what's been happening throughout this, people on low-paid, 0 hours, casual contracts have been less able to stop work or to self-isolate. It's just a fact. And they've, I think, been going into work even if they were symptomatic, just because the support isn't there for them. Or then if you look at the quality of housing, or the poor quality of lots of housing, you've got people living in overcrowded accommodation that isn't in a state of decency when it comes to the upkeep of the property. So I think work on improving housing and people's employment is critical. So we've got something called the Greater Manchester Good Employment Charter, which is an initiative to improve the quality of work, if you like, from the bottom up rather than the top-down route of legislation. Mm-hmm. And it covers the things you'd expect, like a real living wage and 0 hours contracts, but also about more flexible working for people, gender pay gap, a whole range of issues, actually. And we're going to be looking at linking that to public procurement so that we kind of send out a really clear message that, it's not a choice whether or not to be a good employer. There are basics that everyone should be doing. And that is one way in which we can change things. On housing, I would like to be in a position where we could build more social housing at scale. And that's certainly something that I'm asking my team to look at, how we might use this as a moment to solve the housing crisis and possibly build homes for social rent that are also zero carbon. There's a big opportunity, I think, in housing coming out of this.
Yeah, that's great. Thank you. And it's interesting you mention about the commitment to work and 0 hour contracts, because that kind of leads us on to thinking about health and social care, which has been really in the spotlight for the past few months as a result of the pandemic, and social care in particular, where you do have that extensive 0 hour contracts being used, and I'm just wondering what you think will enable that whole. We've had a lot of really positive talk about the NHS. I'm just wondering what you think the whole system, health and social care, needs to come out of this and be able to thrive as move through a recovery phase and then whatever might come after that.
It needs a new settlement, doesn't it? Well, that's what I would argue, and particularly social care. I think when we kind of look at what's happened over the last few months, the position of social care has been sort of exposed, if you like, more clearly to the country than any other time I can remember. I've always argued for reform of social care. The problem I've often faced is it's difficult to get a groundswell of people behind it, because only a small minority of the population are in touch with social care services at any given time. And it's only when it's too late that you realise just how bad things are. If your elderly parents are going through the system or some other experience. But I think finally everyone has seen the problem, how it's been quite kind of brutally exposed. The lack of equality between hospitals and care homes, the kind of different way in which they've experienced this moment. So I think it is a new settlement. You mentioned 0 hours contracts. Unison did a survey of care assistants in the Northwest at the start of the crisis. And amongst other things, it found that 80% of people in that role felt that they wouldn't be paid if they needed to self-isolate. Mm. Now, you could quote a load of statistics about what's going on with social care, but if you just take that one, that 4 out of every 5 social care workers in the Northwest are not in a position where they can promote their own health and the people they look after because of the shocking nature of of their employment conditions.
Mm.
That tells you, doesn't it, that this is a broken system? Because obviously some people will have gone into work symptomatic, and we've seen the challenges within social care. When I talk about a new settlement, let me be really clear about it. I favour social care in England being provided on NHS terms. That means everyone contributes, but then everyone is covered, and it's provided free at the point of use on the basis of need, not ability to pay. I can't see how anyone can justify continuing to kind of defend a means-tested approach to social care, because in the end it means that English social care is as unfair as US healthcare, where those with the greatest needs end up paying the most. And in the case of social care, often hundreds of thousands of pounds for care of pretty poor quality, it has to be said. So that's what I would want to see, Ruth. Whether we will see it, I don't know, but I certainly feel there's a groundswell of calls for reform of social care, perhaps louder than we've ever seen before. So I live in hope.
Yeah, I mean, there does seem to be that sort of growing awareness finally of what social care is, and the value of it, as well as you say, the staff that work within it. And I'm just wondering, with again that opportunity that Greater Manchester, with having a devolved health and social care model, what opportunities are there, aside from where the funding comes from? Because, I won't deny that is a huge issue, but how the system operates. Some places are starting to do quite radical ways of working, things like self-managing teams and community care cooperatives, and I'm just wondering what opportunities might be there for GM to, aside from how we get the funding, but actually think about how we do it differently.
Yes, a good question, because I think the system needs to reform before you put any new funding in, to be honest, because if you were just to take the current system and pour a lot of money into it, it would end up in the wrong places. It would end up in the bank accounts of companies who often don't have the public interest at the heart of what they do, let's put it that way. So I think there's an opportunity to deepen integration of health and social care. I keep saying in Greater Manchester, I effectively want one system. Yeah. And we've had that to a degree, actually, during this crisis. Hospitals were helping care homes with PPE at some of the most difficult moments. And we've absolutely seen a move towards a more systematic approach to social care, i.e. seeing it as a system as opposed to a collection of individual entities. So we set up an alert system for our care homes through this, based on the hospital model, the what's called the OPAL model, the Black Alert model. And that's been an innovation that we've really valued, actually, throughout this, because we've had that greater degree of early warning. Yeah. And the other one to point to is we've also finally brought about an integrated care record for our 2.8 million residents. So there is now an integrated health and care digital record, which is a big step forward. So building on all of this, what's the opportunity for Greater Manchester now? We're going to put ourselves forward to the government as a pilot for a one system approach to health and social care. Single commissioning, and then much more integrated provision. I personally believe, and this is the view of our 10 councils as well, that we need almost a foundational wage for social care. The first building block really is to have a workforce that is kind of equally supported across the entire spectrum, and that would be at the heart of our plans. Effectively NHS terms and conditions for all health and care staff, because without that, we don't think integration will happen until you sort of create that level playing field across the system. So we're going to be putting ourselves forward to the government for a pilot. What we'll be saying is, as you continue to debate the funding and how you raise the funding, use us as a template for how a reform system can begin to emerge. Yeah. And then hopefully at some point soon the funding comes into that integrated system, and effectively you're building what I've always described as a national health and care service. Yeah. I think that's what the country needs going forward.
Yeah, I think that that very much resonates with a lot of conversations we've been having across the country about how we need to join together and work more closely, and we've seen some of those issues during the crisis be highlighted quite starkly, sadly. Yeah. I'm just wondering, with that model, one of the things that we've seen really strongly in this is the strength of communities and how communities have responded, and how they've responded really rapidly to help their neighbours. And I'm just wondering if you move to that kind of centralised commissioning model for GM, and I may be rushing you further down the road of your plan than you've got to, how you would involve communities and enable them to have that real close at home involvement.
That's a really good question. And actually, I was talking to the chief executive of Oldham Council about that topic, because you wouldn't want it to be a very statist, top-down sort of thing. You do need to build from the bottom up. And she was saying that the community hubs that councils have set up to support people through this, and that is with very much sort of everyday, simple support, working with volunteers and charities. She was saying that she thinks they may keep them going forward as a permanent kind of piece of public service infrastructure, because it's been able to, it's helped them improve how they support more people, not necessarily with the bureaucracy that comes with a needs assessment for social care, just simple support. And I think there's something in that, and I'm keen to see if we can keep that infrastructure across GM. And the interesting bit, I think, is as part of the new settlement I was describing, whether or not it could also extend to the NHS and councils having a new relationship with the voluntary sector. I've long believed that we don't treat them well in terms of asking them constantly to put in bids for funding, project funding rather than core costs. I think if we were to do what you're saying and sort of start with communities and build up from the amazing goodwill that we see, it's got to start with a new deal for the voluntary sector. And I would say that is long-term core funding, so that they can kind of really sort of stop living hand to mouth, really focus on a community, know that they're going to be there for the long haul. And I think that would be a much better way to fund them, and actually you'd get so much more back from them. So my model very much is about that, to be honest with you. And I think it has to be person-centred support rather than patient-centric, if you know what I mean. It's got to start in people's homes, in their everyday lives, that simple support, combating loneliness and isolation and all that stuff comes first, in my view. And it's the bit that the NHS, for all of its great strengths, has never been that good at.
Yeah, and it's interesting that what you were talking about there, that idea of, instead of that cycle of commissioning, looking to something more long term. That resonates with. I don't know if you've come across Toby Lowe's human learning systems, which is about, instead of sort of that idea of commissioning for results, but actually embed the person at the centre and enable people to learn and develop. As somebody who used to work regularly on those 12-month local contracts, they're never the easiest to implement.
No, and the amount of effort that goes into them, and it's just, there's an industry in that sort of bureaucracy, isn't there? And all of it implies a lack of trust. Yeah. And I think that comes down from the Treasury. It's as if the Treasury doesn't trust councils, and then and because of that, they then forced them to not trust their communities. And so everyone creates this bureaucracy that ticks boxes and sort of is meant to sort of protect public spending, when actually it wastes a lot of public money. Yeah. And I think the thing about devolution is, so that's one thing I would definitely say. But the other thing about devolution is, in Greater Manchester, I think it really is chipping down these silos between the different departments. So when I came into this role as mayor 3 years ago, I thought, my role would be to integrate health and social care in this area. What it's been actually is integrating health with all of the other You know what I mean? So you take
Yes.
a one system view of everything.
Yeah.
Because then I think you get towards whole person support when you stop this sort of thing where, you know, people just deal with the narrow issue that their department is concerned with. I think if you start to sort of think of a one system approach, it allows you to sort of, you know, consider the whole person and start to spend public money very, very differently than the way we normally do.
Yeah, and that goes back to those health inequalities that we talked about earlier. That, you know, that's been one of that's often a challenge for health and social care, is that the interventions that they can offer won't necessarily address that person's needs if they're in poor housing, or they live somewhere and they've got poor air quality. It is about how does this ecosystem work together, rather than the NHS saving us all.
Yeah, no, absolutely. And you said something really important before, Ruth, about, you know, that keeping that sort of community spirit going. I'll just give you an example from Wigan, which is one that I, you know, really kind of sticks with me. They've introduced something called Wellbeing Teams in social care. So, you know, they've restructured how they do things. And the people who do the domiciliary care visits have been increasingly asked not just to fly in and fly out and then that's it, but to use the time that they spend knocking on the doors of the neighbours and saying, you know, Mr. X likes to go to church on Sunday, or he likes to go down the pub, and they use the time that the social care staff spend building, if you like, social capital around some of the people within their communities. And that is just a simple but profoundly better way, I think, of thinking about how public services work, rather than doing the statutory assessments and everything else.
You just as we're running out of time, you've just hit on basically what I've been working on over the past few years, which is this change to social care and staff being able to be more autonomous, to work on well-being as opposed to a time and task model. And I think that's a really interesting one, is especially in social care, why do we focus on those basic things in life rather than we find out what that person needs to live well, which is connection with their community, connection with, and I think, you know, the crisis has, you know, the community hubs, you know, as somebody who's been involved in one in my area, and it, you know, residents who are happy to do those small tasks that make a difference in people's lives is a real shift in practice.
It is, isn't it? And you know, I've thought a lot about this over the years, and I'm particularly interested around dementia and, you know, dementia care. So the system would say that the way you care for somebody with dementia is obviously in a, you know, very quiet, let's say, nursing home, a nice, safe, you know, seat in the corner, you know, everything sort of health and safety in the right. Is that care? And I would say not necessarily. If you want to care for somebody with dementia, the best thing you can do for them is to reconnect them with the things that they were passionate about earlier in their life, because those are the memories that are deep, deep inside, and they never go. And that, I think, is, if you go with that, you then have to fundamentally rethink how you care for somebody with dementia. I always tell the example. There's a sensory farm near me here in Wigan, and they set it up as a, you know, dementia farm, they called it, and they created a fishing lake because they knew there was a bit of demand from the older gentlemen around that they wanted to carry on going fishing. And I remember being at this lake where a minibus turned up with some care home residents, and one of the care assistants wandered over to me, and I was just watching this unfold, this thing, and I was just seeing these blokes getting the reel and the line, and she just wandered over to me and said, "Do you know what? Most of these fellas just sit motionless in the chair when they're in the care home. And they can't do much, or they don't know much, but they knew every little bit of it, you know, because those memories, things that they love doing, have never gone, and they immediately were back in a place where they wanted to be. And that little example has always sort of lived with me. And I think we've got to rethink. We need a much more person-centred approach to the way we support people. And the risk, of course, of social care on NHS terms is you might get more of a medical model taking over, and I wouldn't want to see that. What I'd actually like to see is the reverse. the NHS culture, the social care culture, kind of back infiltrating the NHS as opposed to the NHS taking over social care. And for me, I keep saying this: we won't have 21st century health and care in this country until it supports people with dementia as well as it treats cancer. Yeah. And we're miles from that at the moment.
Yeah.
But maybe, just maybe, this moment we've been living through means that social care might finally be fixed.
Yeah. And I think it's an interesting point you make about, is that care? And I would kind of flip that as well and say, is that life? Is that, is that the life we would want if somebody told us when we're 30 that's what your life will be? I'm sure most people would say, I definitely don't want that to be my life.
Because I'm very conscious that I'm the mayor at the time that the Hacienda generation is getting older in Greater Manchester, and I'm pretty certain that they will want something different from later life. So.
And we'll hold you to that. You've already done DJ battles with the Mayor of Liverpool.
I have. That keeps us all feeling good.
I'm conscious that we don't have much time, and I just we've talked a lot about some of the challenges, but it would be really good to end on a brighter note and just ask what has given you hope during this past sort of few weeks and months.
Well, certainly the way in which communities have rallied round and the way that we've been talking about. But I get the feeling that a lot of people have looked at the world with new eyes. They can see some of the unfairnesses around them a bit more clearly than they could before. It's not been lost on, I think, a lot of people that, while there's been a group of people that have been at home having Zoom conferences, there's been a whole lot of other people out at work and not able to keep themselves safe in quite the same way. And though we call them essential, they're not paid as essential workers. And I think that is really clear to people. As I said at the beginning, why have we had one of the highest death tolls in the world? I think it is linked to inequalities in our country that go back a long way, but have been exacerbated in the last decade. There are too many people in jobs where they can't put their health first because of the way they're paid and the lack of support if they need to be off work. Too many people whose housing damages their health. And, I'm really struck by, I think, the different public debate which seems to be emerging about those things, and a growing sort of call to say, well, no, that cannot be right and cannot continue beyond this. So that does give me a bit of hope that there's a sort of there's a mood to change around the country. We'll see. Yeah,
that's great, and that's very much what our work at the RSA has been about. This idea of a bridge to the future. How do we build on these positive things that have come about during this crisis, and how do we keep them going? So
we've spoken of Build Back Better, and it's in some ways sounds a bit like a pie in the sky or a pipe dream, but in another not. There's going to be changes, aren't there? We can see physical changes to the roads with the numbers of people cycling and walking, which is great. I think more people are going to have a more flexible working life from here on in. Nothing wrong with Zoom conferences if more people have the chance to do it. So I think that's going to be a change that stays with us. But I could see if the government was willing to work with people like myself, the mayors. We've got a group called the M9 of mayors. Sadly, all men. Maybe that will change too one day. But I'm pretty confident it will. We're saying to them, look, work with us in a different way. Empower us to lead some of this change that we want to see. Personally, think we're going to see an acceleration of progress towards a zero carbon country. I think is going to be one of the things that comes from this, because I know from my point of view, where can we create jobs? It's not, when you're looking at a situation where we might have large job losses, there are definitely jobs to be had in the green economy. No question about it. And I'll give you a really specific example: the retrofitting of properties to make them zero carbon. I'm told there could be thousands of jobs in that in Greater Manchester. So So I would say get on with it then. That would be my message to the Chancellor. Let's do that now, really crack on with it. And also clean air, we're going to bring in a clean air zone in Greater Manchester in 2022, and it will cover our 10 boroughs. Again, my message to the government is just accelerate it now, make support available for people to, taxi companies to change their cars, van drive, crack on with it, and let's keep this clean air that we've been enjoying. So Build Back Better, I think, is going to be more than a slogan. I think we are going to see positive changes come from this. That's
great. And thank you for that. That's a perfect positive note to end on.
No problem.
And that's all we've got time for, I'm afraid. So thank you so much, Andy, for talking to us.
Oh, it's really nice chatting to you, Ruth. Thank you.
And thanks to everybody who's tuned in today. And before we sign off, a quick reminder to everyone watching, stay tuned to the RSA channels in the coming weeks for all our latest online events and podcasts, as well as news from our policy research team and our 30,000 strong fellowship network, which is around the globe. And finally, an extra special thank you to Andy for taking the time to talk to us. So thank you all for watching, and take care, everyone.